Hi, good afternoon. My name is Adam Thacker. I'm the Chief Operating Officer here at Good Samaritan, and this is another session of our Facebook Live. We have special guest Jelena Carey here with us today. Jelena is an occupational therapist here at Good Samaritan. She has her master's from University of Southern Indiana and special certification that we will talk about here in a moment. April is Occupational Therapy Month, thus the topic, and thought it would be good to give the community some education on what you do as an occupational therapist every day. A lot of time spent in our inpatient rehabilitation unit working with those patients. So without further ado, I'll kind of kick things off with just asking you, tell us occupational therapy, a day in the life of kind of what you do.
All right, well, thank you for having me. It's great to be here. So with occupational therapy, especially on inpatient rehab, depending on what setting you're in, it's different for all OTs. But on rehab, we work a lot with helping people get to home. So we work through rehabilitating their self-care tasks, so helping them get a shower and get dressed. We start with that in the morning. Later, after breakfast, we typically work a lot on strengthening and making sure their arms stay strong. If they have a leg weakness or difficulty walking, they're going to need their arms to help compensate, especially as they use a walker. So we work a lot on strengthening. And then in the afternoon, we kind of address what their concerns are, what their needs are. That may be cooking, maybe a cooking task, maybe balance, it may be standing tolerance. We kind of go into what their interests are.
Yeah, and I think that's a crucial element that you mentioned. We talk a lot about care being, very much a collaboration with patients and with the professionals such as yourself that are providing that care. Everyone has different goals, and certainly therapy is very much tied to patient goals of what was your baseline, what do you want to do. So in your role, you're able to work with the patients and tailor that specifically to patients, correct?
Absolutely. Everything we do is client-centered. So from the very first day, we ask them, why do you think you're in the hospital? Why can't you go home yet? What's your biggest concern, and what do you want to work on? And then we tailor their treatments directly to them and their needs. There is no two patients that will have the exact same treatment. They may do similar things, but we're doing it for a purpose that's specific to that individual.
Sure. And also what has led them to needing therapy.
Absolutely.
We were talking right before we came online a few years ago. A lot of the focus on inpatient rehab was doing therapy post total knee, total hip, joint replacement therapy. Now that's really moved out of the hospital, and there's still therapy, of course, but it's more in-home based therapy and outpatient therapy. And now you're seeing a different set of patients that are on the unit needing help.
We are. So on rehab, we typically see patients who've had a neurological event like a traumatic brain injury or a stroke. We see a lot of patients who've had Parkinson's. We do have a therapist who is specialized in Parkinson's, so we can really tailor treatments to them with the latest evidence-based practice. We see patients after they've had car accidents or if they have multiple trauma, multiple fractures for whatever reason. Of course, we've seen a lot of patients post-COVID. Some of our patients have just been in the hospital too long, or they didn't recover well after a surgery, and they just got really weak. And then the need for therapy on rehab is if their goal is to get back home and they were independent before and they want to go home again, then rehab might be a good stepping stone for that. It keeps them out of a nursing home and helps them build the strength where they can get home, where their family can make plans to care for them, or they're more independent and don't need their family to help.
Yeah, and that's wonderful. And the time to recovery with the trained professionals that know how to move forward, and we all sometimes need a little extra push to move forward and can do more than sometimes we think. And
Absolutely.
So you're a coach in that regard.
We are. When you don't feel good, you don't want to get out of bed and do stuff. And so we really do help facilitate that. It's funny you bring the coach thing up. I coached for a long time at South Knox. And so I use that a lot. I tell our patients when they come to rehab, they're part of a team now. And I don't just mean them, but the therapist as a whole. On rehab, we work as a team. Nursing and physical therapy, speech therapy, occupational therapy, and social services all work very, very tightly together as a team unit. And then we bring our patient into that team to help focus on what they want to accomplish and achieve. And so I always tell them we are like a team that I can't put the work in for you, just like an athlete. I can't do the work to make you play NBA, but I might be able to tell you the skills that you need to get there.
Right. And you mentioned physical therapy. I think maybe good to clarify occupational therapy versus physical therapy. There's some similarities, but there's also some obvious differences when you're working in that space.
Yeah, there are, and they do get confused a lot. Physical therapy has been around a little bit longer to the public's knowledge, and so that one is more easily recognized. Typically, physical therapy works on walking. The easy way to split it is from the belly down is going to be physical therapy, from the belly up is occupational therapy. Okay. But really, it's a lot more than that. So physical therapy works on your balance and your standing and your walking. Occupational therapy does what you want to do, so the functional tasks. So a physical therapist might help you be able to walk to your kitchen, but if you didn't have occupational therapy to work on cooking skills and hand function, you're not going to be able to cook a meal.
Sure.
So that's the easiest kind of breakdown between the two.
Great. And then we often think with therapy, getting our muscles going and movement and things that we can see, but your certification is actually in that, in being able to see. And so you have a special certification in visual impairment and low vision, so helping to train and rehab the eyes.
Yes, I do. So like you said, we often don't recognize how much impact our vision has on our daily life. So at the root of OT, our goal is to help you do what you want to do every day. If you can't see to do that, if something changes your vision suddenly, then your whole life is going to be set off. So an eye doctor might work on your acuity or your ability to see, like if you need contacts or glasses. What I work on is more of how you react to what you can see. So I do a lot of exercises to train your eyes. Your eyes have muscles. You can strengthen them just like anything else. I work a lot with eye teaming, so getting your eyes to work together where maybe you're not seeing double vision. If you're having an issue where part of your vision's removed suddenly, like from a stroke or a brain injury, I help teach you how to compensate for that so that you can still do what you want to do at home and at work, but you can do it safely and with an increased independence level.
That's great. So we talked about inpatient rehabilitation, and certainly when we think inpatient versus an outpatient setting, inpatient, a higher acuity, severity of need. Somebody's in the hospital getting therapy on a daily basis. From an outpatient perspective, for somebody watching this currently or later, how would somebody may have heard something and said, "Hey, I think maybe an occupational therapist could help me with some of my daily skills." How would they go about contacting Good Samaritan and get engaged with occupational therapy?
So in order to go to outpatient occupational therapy, you have to have an order. Your doctor can write an order, or there's some new information out, and since I'm not totally based in outpatient, I'm not entirely certain when I speak to this, but I believe you can self-recommend or self-refer yourself to outpatient. If you called the office at Clearview, the outpatient therapy office, they could give you more information on that.
Great.
But in order to come to outpatient therapy, if you feel like your hands aren't functioning the way you wanted, or you're having a lot of shoulder pain and it's really affecting your ability to do your daily life and do the activities you want to participate in, then get a hold of your family physician and ask them for an OT order, and they can recommend that you come and get some treatment.
Sure. Well, and just to expand on that, having that physician relationship, a primary care physician, or certainly if you're seeing a physician for an ongoing need that maybe occupational therapy could play a role in, then work with your physician to get that order. We have outpatient services that can help to get folks back to cooking or whatever their daily skills that they want to. We won't promise you will be a good cook. It's just being able to cook. There are different classes for that.
That's right.
Anything else you'd like to add on occupational therapy?
I just think the occupational therapy is a wonderful profession, obviously, because I chose to devote my professional career to it. It really works to help you do what you want to do and increase your independence and your function in your life, whether that's knitting, getting yourself dressed, going to the bathroom, or cooking a meal. OT's there to help you along the way.
Yeah. Well, thank you for your service at Good Samaritan, and as an occupational therapist, obviously you're helping a lot of patients to get back to those skills and lead a higher quality of life, and being able to do that, and happy to be able to have Facebook Live and recognize you and your profession during Occupational Therapy Month.
Oh, thank you.
So before we close things out, we'll see if there are any specific questions, and I'm getting the nod from 2 people that there are no specific questions. So as always, if there are questions down the road as you watch this, you can contact us through Facebook. We'd be happy to answer those. And anything technical, I will get Jelena back in contact, and we'll be able to answer those that way. Thank you for attending Good Samaritan Facebook Live, and we will see you again in a couple weeks.
Thank you.